My name's Regena Young. I'm the Outreach and Injury Prevention Coordinator here at Erlanger for Trauma Services. And I'm with my good friend Eve Nite here from Erlanger Behavioral Health. And we want to talk with you a little bit about mental health awareness and being safe and taking care of ourselves during the holidays. Eve, I'll let you introduce yourself.
Well, hello. So I'm Eve Nite, and I am with Erlanger Behavioral Health Hospital. I'm also the chair-elect for the Tennessee Suicide Prevention Network Advisory Council, which advises our governor about suicide prevention strategies. And then I also work in our region with our crisis intervention team through our Hamilton County Sheriff's Office and Chattanooga Police Department.
One of the reasons we've gotten together today is we really want to talk about mental health precautions, how to take care of ourselves, what to look for. Right now with COVID keeping everybody kind of isolated, it can be a challenge to take care of ourselves. What we want to emphasize is, what do we need to be concerned about, Eve, you think, when it comes to not being able to connect with folks as easily?
Yeah, it's so interesting because one of the biggest risk factors for someone to experience any sort of emotional or mental health issues is disconnectedness. Mm-hmm. It's both a symptom of mental health issues when somebody is withdrawing and they're not as engaged with others around them, but it's also a huge risk factor. So someone who is isolated and doesn't have those connections are also at risk. It's kind of a little bit of a spiraling or vicious cycle there when we talk about isolation.
Well, obviously, staying connected has been a challenge. What are some of the other symptoms? If we have a family member, maybe someone who's older that's had to stay at home, be isolated, what are some of the other symptoms that we can be looking for if we're concerned about them having some mental health challenges or being depressed?
Absolutely. And I do want to be clear that it's so important that we do take these health precautions, that we do isolate as much as possible, that we keep distance, physical distance from each other, because we do have a global crisis going on. But you really need to look out for people who are starting to feel maybe hopeless or helpless, someone who maybe just feels really foggy-headed, right? So they can't think. Maybe their affect is really flat. They're not taking pleasure in things that they used to take pleasure in. Maybe they are starting to sound a little bit depressed, that they're kind of sad, or maybe they're not able to see any good in anything anymore. Mm-hmm. Those are some hallmark signs that someone might be experiencing onset of depression.
One of the other things I always like to point out is if you have these emotional type situations going on, it certainly can affect you physically as well. So maybe you see some more challenges with maybe your blood sugar or feeling fatigued. Maybe you get sick easier. So there's also a physical component that goes with it. And certainly, not only are we talking about adults, but we also want to know what to look for in our children and adolescents and how it's different for them, and what to see when they're having maybe some crying spells or they're being very clingy. What are some other things you think of when it comes to younger children?
We were already experiencing unprecedented levels of depression, anxiety, and suicidality among young people. I mean, suicide is the second leading cause of death for ages 10 to 34 in Tennessee. Mm-hmm. And we had seen a 30% increase in suicide attempts and deaths among our young people. So it can look very different. We're talking about, we've had stress now for 10 months, this acute stress, this toxic stress, and our young people's brains are still developing, and so their poor little brains have less coping skills and less resilience than us as adults. We're seeing a lot of aggression, irritability, maybe a lot of outbursts, maybe some emotional regression, so spontaneous crying, or just reacting or acting out. It's really, I think, important for us to have patience, but to be watching our kids so closely. For those that have kids that are doing remote learning, watch what's happening, watch them as they interact with other students, watch what they're texting to other people and what they're looking at online. Preoccupation with death. is another big symptom, especially among our teenagers.
Mhm.
And then general withdrawing, not talking, again, having maybe a flat affect or having these huge ranges in emotions are all symptoms that there might be something underlying.
Absolutely. And I know we've touched on seniors and kids, but certainly anyone ages 30 and up that has some type of financial responsibility, maybe they've been laid off their job, they certainly too can have any of these type symptoms that we've discussed. What also we'd like to talk about is, well, what can we do to help these folks? What resources are out there to get them help? Because we want to address this health care for our emotional well-being, just like we do if we're trying to take care of our high blood pressure or get over or prevent having a cold. So what are some of the activities we can do to take care of ourselves?
So what we're talking about here when we talk about this increase in depression and anxiety and suicidality, we're talking about the fact that we're all under extra amounts of stress. And of the 9 evidence-based risk factors for suicide, we're experiencing all 9 factors collectively as a society. Financial loss, as you mentioned, isolation, chronic illness onset, fear of being a burden to others. All of these things are definitely evidence-based risk factors for developing mental health conditions. So the good news is that there's also protective factors. There's things that we can do to protect our health, much like we take precautions like washing our hands and physical distancing and isolation. We can also do things to strengthen our own resiliency against mental health conditions. And as you mentioned before, a lot of these mental health conditions, especially ones that come from that chronic stress, really manifest physically. One of the ways it manifests is in chronic tension. So you might be feeling tension headaches in the back of your head. You might feel like your back is sore. You might have a depressed immune response because your immune system is overactive. So what you can do is create a plan. And I believe that we're going to have a template to help you create a plan. Something you can do every single day, though, is just move. Move your body. You can't be stressed. Your muscles can't be under tension if they're moving. So whether that's doing some progressive muscle relaxation where you're just scrunching up your muscles and then you're relaxing them, whether it's taking a walk and enjoying the benefits of being outside in the fresh air and sunlight, or if you're just in your chair, maybe you can't walk, maybe you can't go outdoors, you can always crank on some tunes and chair dance, okay?
Absolutely.
Which, fun fact, if you ever see me driving down the road, is also what I do during my commutes. Because
Absolutely.
what better time to crank the music loud and get moving in the car to move around? Things that we must be doing daily or weekly is connecting intentionally with others. FaceTime, call, handwrite letters. I got a handwritten letter today and it was so special. Handwrite letters to each other. Think of ways that you can connect outside of that physical face-to-face, and then be intentional about doing that as often as you feel. If you feel lonely, if you feel hopeless, reach out and connect with someone else. And if those things aren't enough, you've got to get professional help. We have unprecedented resources in our community for telehealth psychiatry. We at Erlanger Behavioral Health Hospital have a virtual IOP that's just amazing. It also includes med management with some of the best doctors in this area. And then we have inpatient resources. So anybody who is experiencing mental health crisis, if they're feeling like they want to die, if they're feeling like they might be at harm to themselves or someone else, if you're seeing an increase in substance use to the point where you feel unsafe, any of these reasons are reasons that you can come and be in a safe and secured setting and get the treatment that you need. And I have to say, our medical professionals have gone to really great lengths to make sure that these resources are available in a safe way. You don't have to be concerned about COVID when accessing these mental health resources. So lots that we can do. That's the good news. My only cautionary or my only caveat to that is we have to be intentional about doing them. It doesn't work by osmosis. We can't just think about wanting to do it. We can't talk about needing to do it. We are at this point as a society where we must do these things in order to protect ourselves.
take steps. So 2 comments I'm going to make. One, for those of you who are not familiar with the term IOP, stands for Intensive Outpatient Therapy. So you can certainly be seen in a setting there at either Erlanger Behavioral Health or one of the other facilities in the area, but you don't have to stay inpatient overnight. And then the other piece is I want to make sure that we all have a plan. We're talking about the mental health plan, but right now with COVID, a lot of us are feeling out of control, and that we're worried that what happens if we get COVID. If you go ahead and make a plan for how you're going to react to that, just in case it happens, I've always said that wards off evil spirits for good measure. But if you have a plan, even if it has to change moving forward, that does leave you feeling more in control and you're being proactive instead of having to react to getting sick. So I think that's a crucial part of helping our emotional well-being also. Anything else you think we should include in our conversation here, Eve?
I do. I think it's also worth mentioning that a new report came out that showed about 20% of people who do get COVID experience a diagnosable mental health condition, mostly depression or anxiety, within 90 days following their diagnosis. And I think that's significant because a lot of our first responders and our healthcare workers are getting COVID and they're experiencing these types of issues as well. But at this point, 20%, we've got about 20,000 cases. 20% is 4,000 to 5,000 people in our own county that might be experiencing what we call clinically significant or diagnosable. A clinician can tell you this is a diagnosable condition. It's important to remember that treatment for mental health conditions is effective over 90% of the time. You don't have to live, you don't have to suffer alone, and you don't have to suffer in silence. We can help you and we're here for you.
Absolutely. I agree. It's crucial that those of us that are frontline workers, whether that be EMS, fire, police, food service workers, of course nurses, because I'm a nurse, and our physicians, as well as our techs, and everybody else that contributes to caring for these patients. We're under a great deal of stress as a society, and so taking care of ourselves and being aware is certainly a crucial role in maintaining your health and wellness all around.
Absolutely.
All right. Thank you so much for being here, Eve. I really appreciate you taking the time for us to sit down and talk.
My pleasure. Anytime.